Recording. Okay. Next thing we're going to discuss is the different padding that we have for the treatment of hammer toes. What a hammer toe is, and we have a little bit of a hammer toe here as well, where a toe actually curls like this. And patients will either get pain on top of the toe from rubbing on the shoe, the tip of the toe as the toe kind of pokes the ground more aggressively, and depending on what that is, we'll just have you dispense certain types of padding. There are multiple pads that do the same thing, and I'll show you how those work. So first, there's the Silipost toe tube. Okay, what this little guy does is for people that have pain on top of their toe or the tip, it actually treats both because it goes over the whole toe. Now you can see it's quite a bit longer than the actual toe itself, and these do come in different sizes, so you'll pick the appropriate size for the toe. But on the inside, there's actually gel. So what you're going to do is you'll tell the patient this is something you slide over your toe, and then once you determine what length you need, you actually take it off and cut the excess material off the back end. So in this case, we'll use the second toe as an example. And you're just going to basically slide that on the toe. Now this one's obviously too long, so you have to cut some to get that to go on appropriately because it'd be very difficult otherwise. I can try, but there you go. So obviously you can see that this is too long, so they would mark where that area was there with a pen and then take it off and cut it. Okay, and that's something they wear during the day only. All these pads are only for use when you're walking during the day. They should be taken off when they sleep at night. This does a very similar thing. This is another gel pad. It has gel on the inside. It's designed to protect the top of the joint there. They do the same thing. They would just basically slide this over the toe. This one's a little small for him, I think, but just slide it over like that. Protect that little spot and make sure on the underside that that's not wrinkling up at all. Otherwise, it'll irritate the skin. We do have some other examples of pads similar to that. These are called the Dr. Jill's Gels All Gel Toe Tube. And what you'll notice that when you open this up, there's different sizes. This one happens to be a large. This will be used for the big toe. It comes in a big long tube, which is nice for the patient because then they get multiple use out. They'll actually cut it at home so it's the appropriate size, and then they'll have extra for later. But it's a little silicone tube, pretty elastic. What they'll do is they'll slide it over the toe, and this is more for rubbing in the top, or even if their toe is rubbing in the side of the shoe or the adjacent toe. They determine the length that's appropriate, mark that, take it off, and then just cut that excess off. There's also a toe cap. So for those patients that are complaining of pain, complaining of pain at the very tip of their toe, this little guy slides over the toe itself. The hardest part of application is getting it out of the bag. So literally these may need to be cut as well. So if it's a smaller toe, you literally just like the brown one, you put that over, and that will cover the toe just like that. Now for those patients that have a severely contracted hammer toe, and usually this second one, it wants to pop up like that and it causes them lots of pain in the bottom of their joint here, we'll, in some situations, dispense this as a way to prevent the need for surgery. It doesn't cure the problem, it just makes it more comfortable for them to walk. It has a nice cushiony pad for the bottom of their foot, and it also has this little strap. This little strap pulls the toe down. So what you'll do is you pull it out so you'll have a little excess to work with. You'll slide that over the toe. This is obviously for the use in a shoe, because if you don't have a shoe on, it's not going to keep that toe down. And you literally advise the patient that they pull their toe down like that when they wear it. And if you need to pull the strap in the bottom of the foot to tighten that around the toe, you can definitely do that. But that just makes it more comfortable in the bottom of their foot, and it straightens their toe out when they walk. For those patients that have severely contracted toes and they're feeling the tips of their toes hurt because they're pounding or their nails are getting damaged, we have this pad. It's called a hammer toe cushion. And of course I grab the left, but in either case, this little guy's got a little teardrop shape to it. And this one actually, no, I'm sorry, this is a right. What you'll do is the same, just like the one I just showed you, the Budin splint. You're going to pull this little guy out just a little bit. Okay, that gives you room to go around the toes. I always recommend, you look at the picture on the box. It's going to show you going around one toe. Typically, the patients that have this problem are going to typically have blood flow issues. They're diabetic, they're elderly. I don't like going around one toe if you can help it, unless they're very large, okay? Because you can create a kind of tourniquet effect and they can lose blood flow, especially if they have numbness to their feet. So I actually recommend you put this around two toes, so the two adjacent toes here, the second and the third. Make sure that that pad is nice and flat so it's not irritating their skin, and then gently tighten that up just so that stays in position. And when they walk, it'll take that pressure away from the tips of their toes and make it much more comfortable for them. and those are the hammer toe padding.